Good morning to all of you. I am presenting author with the topic Effect of Pupil Dilation on Biometry Measurements and Power Calculation Formula with the IOL Master.
So you are a non-ratified member.
Yes.
Okay. So we will not be giving marks to you.
Okay.
Okay. But
Definitely.
you are.
I am having no financial interest in any of the product or techniques mentioned or discussed in the study. The success of cataract surgery depends on many factors, one of the most important being accurate calculation of IOL lens power. Three main measurements are used for the IOL calculations are axial length, anterior chamber depth, and corneal power. Currently used optical methods include the IOL Master 500, Lens Star 900, IOL Master 700. For more than 15 years, IOL Master have been benchmark. Third generation IOL calculation formulas such as SRKT and Hofer-Q do not include anterior chamber depth and lens thickness. However, fourth generation formulas such as Haigis, Holaday include both ACD and the lens thickness variables. When the ciliary muscle is relaxed, the suspensory ligaments are taut, which cause the lens to be thinner, thus ACD becomes deeper. To evaluate the influence of the pupil dilation on biometric measurements and recommended IOL power calculation by third and fourth generation formulas using IOL Master was done as the aim of the study. The study was prospective, observational, comparative study done between August 2022 July 21 at FRIMS, Ranchi, and the ethical approval was taken from the Institutional Ethics Committee. All age-related cataract was included, excluding those with prior eye surgeries, with an active ocular pathology such as uveitis or retinal degeneration, or with inability to fixate because of any eye disease and prior contact lens use. When both eyes met these criteria, only the right eye was included into the study because measurements will be more similar between the fellow eyes than individuals. For each participant, two biometric measurements were acquired using the IOL Master 500 prior to and after dilation. Every measurement was done in the same examination room and under the same scotopic light condition. Recommended IOL power for SM60 WF9 were calculated by the third generation SRKT and fourth generation Haigis IOL calculation formulas. For a descriptive statistical analysis, we use Excel 2011. Result was shown on the mean plus minus standard deviation. Significance was set at p less than value 0.05, and data were compared using a paired sample t-test. A total of 52 eyes of 52 patients, where 30 were male and 22 were females, with a mean age of 66.53, having range 52 to 81 years, were included in the study. This is a table one showing the ACD with a significant mean difference with of 0.12 plus minus 0.35, and the keratometric reading and the axial length having no significant difference. This is a table 2 showing the IOL power calculation using the SRKT formula having no significant difference, while the those calculated with the Haigis have the significant difference of 0.07 plus minus 0.54. The axial and the corneal power measurements did not differ significantly after dilation, having value 0.005 mm and 0.001 respectively, while the ACD had a significant increase of 0.12 plus minus 0.35 mm. Variation coefficient was higher for the ACD versus the axial length and the keratometric reading. The IOL power choice based on the SRKT formula was not affected significantly because of the dilation. The Haigis formula showed a significant change in the calculation post-dilation. A number of studies have reported the influence of the pupil dilation on the biometric measurements. Cheng et al., Heng et al., and the Sheng et al. Found that the AL was not significantly affected by the pupil dilation. Villalobos et al. Observed no change in the corneal curvature radius after dilation, but Seto et al. Demonstrated that the pupil dilation could influence corneal curvature radius. Cambipant et al. Showed that the ACD was significantly influenced by the pupil dilation. The significant axial length variation after dilation found in our study was consistent with the previous finding of the IOL Master reproducibility and repeatability. Nevertheless, the significant increase in the ACD with a variation coefficient of 4.14 is interesting, and this is the only factor clearly affected by the dilation. It would be logical that the IOL power calculation formulas based on the ACD would be altered. This would be especially important for users of formulas that include ACD into their ELP algorithms such as the Haigis, Holaday 2, Olsen formulas. Finally, the conclusion is there is no clinically significant effect of pupil dilation on the IOL master measurements of axial length, corneal power, and intraocular lens power calculated using the SRK-T formula. However, a significant increase in the ACD and the IOL power calculated is found using Haig's formula. Thus, pupil dilation status at the time of the IOL master acquisition should be reported when submitting data for constant optimization. Thank you.
Good paper and good data, but the thing is, you have these two formulas are different. SRKT formula doesn't take into consideration the anterior chamber depth. So you should compare it with the two formulas which take into consideration the anterior chamber depth, like a Barrett formula and other formulas. Then only this comparison is relevant. And otherwise, this presentation is misleading that if you are doing it with SRKT formula, then it is no significant differences there. So we can use that also. But ultimately, what matters is the latest generation formula has come just because they take into consideration effective lens position. Because all these things matter into the effective lens position, and then we have a accurate IOL power calculation. But anyway, your efforts were good. Thank you.